number and then the ICU a week later. And you can look at this rapid rise in cases from the end of March to that first week in May when we peaked. That's related mathematically to the doubling rate and to the transmission rate of the disease. So in that April time frame and March, for every person that got the disease, they were giving it to about 2.5 other people. And logarithmically, our admissions went up quite quickly because of that transmission rate. The governor put in place some pretty significant restrictions. That transmission rate came down, and quite rapidly, we got back to double-digit and then almost single-digit numbers of cases for most of the summer. As we got into late summer and into the fall, some of those restrictions were eased. People got a little tired of their masks, mask fatigue, and we started to see the transmission rate go up, and then that was followed by inpatient cases going up. Now, what's interesting is that, and thankfully, the slope of that line is nowhere near as steep as it was in the springtime. Even some of us doing the right thing some of the time with masks and social distancing and eyeglasses in clinical areas, that has an impact on that transmission rate. But it is still over 1, and therefore we continue to see cases rise, and we expect cases will continue to rise until we see that transmission rate fall or additional restrictions put in place. Now, the biggest concern for us is you've got the Thanksgiving holiday, you've got a large burden of disease out in the community, and you've got more people moving indoors, and we know that the transmission of the disease increases when you're inside. So you have to be very, very careful when you're inside with others. Previously, when we were doing our town halls, the person speaking would take their mask off. Today, I've asked that everyone keep their mask on under the new safety protocols that we've enacted. Only when you're in your office with your door closed, if that, can you take your mask off at this point. So we'll be remaining masked throughout the presentation. So we are certainly in a second surge, but we are ready. We are ready because we prepared during the slow period of time. We stocked up on PPE. We reviewed the protocols and the work that we did in the first surge and found new, better ways to prepare for the surge and to manage the surge. And we are much better, I think, at treating this disease because we've got new tools, remdesivir, high flow oxygen, and so we're seeing people with a shorter length of stay when they come into the hospital and less people ending up on ventilators. But the one thing that I think we're in worse shape on is we're tired, and we should all recognize that. And because we're not fully rested from having come out of the recovery in the first surge. And it's also been much more difficult for us to recruit staff in from the rest of the country because the rest of the country is actually worse off than Massachusetts for the most part. I've looked at the state data. We're probably better than 3/4 of the rest of the country in terms of number of hospitalized patients per capita. So surge capacity is going to be needed, and if the DCU were open today, we'd be sending patients over there because we haven't a load of patients here that would be perfect for the DCU. DCU is I think a better place in some ways for the low acuity patients that require care for COVID because the patients can get up, they can walk around, they can take a shower. We have a great team that did it before that is doing it again, led by John Broach, Peter Lansett, and Sharon Rudnitsky, and we thank them for rallying once again. The governor to date has only authorized for us to stand up the surge capacity. I think that's for two reasons. One, Central Massachusetts seems to be on a leading edge this time, but more importantly, because he has so much faith in all of you to be able to get this done. And I do think of all the field hospitals and external to the hospital areas around the country that were put up, our field hospital was probably the most utilized given its size and most efficient. And so I want to just say personally, thank you to everyone that's working on that right now. The oxygen's going in today. We'll anticipate opening up the first week of December, sooner if we have to, if we get full. And if anybody knows someone that might be interested in working over there, UMassMemorialResponse.com. UMassMemorialResponse.com. That is the website for people to upload it and to their CVs and to volunteer. And we really need some extra help this time because unlike the first surge, the hospital was relatively empty from surgical services and other things. And we could redeploy people to the DCU. We're not able to do that this time. Again, thank you to the team that's working there. The other thing we need some help with is the Stop the Spread campaign. This is our community-based testing events. We would like to extend hours and get more people tested. Marlboro is doing this, started this at the sports complex. This is downtown Worcester. This is the line of people trying to get through. My understanding is now they are testing someone every 24 seconds. That's a lean operation for sure. But we really need some folks to serve as clinical swabbers to do the anterior nasal swabs, and also need some help with registration and other things. So Monica Lowell is leading that here in Worcester, Steve Roach in Marlboro. If you know anybody, if you'd be willing to volunteer or spend some time down there helping us out, would really appreciate that. This is my favorite topic, the vaccine. And you know, I personally, I'm sick of playing defense. I'm ready to play some offense. And I'm going to tell you what I think is going to happen in terms of the vaccine. And then maybe by the end of the day, I'll get some other news, and that'll be different. We were was on a call with Seema Verma, the head of CMS, today, and we talked about this. Also talked about this at Massachusetts level with the governor today, and then Michael and I and Steve Roach are on a call, the UMMHC board meeting, where we talked about it as well. You're hearing a little bit different things from different people. But I think if you put those things together, you can kind of project what's likely to happen. And thankfully for us, our own Dr. Finberg, the chair of the Department of Internal Medicine, led the clinical trial here within the medical school. So we have some experience with this, and Bob is on the state panel that is advising the governor on this. So this is what I think is going to happen. And we can check in to see how accurate this is. I think there's going to be emergency use authorization for the Pfizer and the Moderna mRNA vaccine within the next 2 weeks. And then shortly thereafter, or maybe even before, anticipating that there will be emergency use authorization, they will start to push the vaccine out to hospitals first, and to elder care sites second. And the reason to hospitals first is because we need to get caregivers that are taking care of COVID patients, that are working the COVID units, vaccinated first, for two reasons. One, they are at the greatest risk. And the second is that the most critical asset as we manage this second surge is to make sure we have the caregivers necessary. So we are seeing increased infections in our caregivers, which then they aren't available to take care of patients. And for those of you that have ever served in the Medical Army Corps, you'll know that our motto was to conserve the fighting strength. And right now, more than anything else, as the vaccine comes out, we must conserve the fighting strength. So we must make sure that caregivers get it first, because they're who we need to be able to take care of the patients. And as we get more and more cases, we're going to need them more and more. So I think that before January 1st, we will be giving caregivers, first those that are working on COVID units and in high-risk areas, EMS, emergency medicine, certainly the critical care on the floors that are taking care of COVID patients. I think they're going to be the first to be vaccinated, and I think that'll start to happen before the first of the year. Couldn't be more excited, but I will tell you it's going to be crazy for a while, because the more and more the doses become available, the distribution is going to get more and more complicated. So Andy is leading a team that's looking at the vaccine, how we distribute it, who gets it, and assuming that UMass Memorial gets a significant number of doses, at least enough to get all of our caregivers that are working with COVID patients vaccinated, and he'll bring that back to us through the COVID task force for final approval. New treatments. You may have heard that there's a monoclonal antibody now available under emergency use authorization. For us at UMass Memorial, all of our hospitals under the leadership of Dr. Jonathan Gerber have been treating patients with convalescent plasma. That is a polyclonal antibodies. Convalescent plasma has lots of different types of antibodies against the coronavirus, attacks it from multiple angles. So we are still doing that in inpatients under an emergency use authorization. We've looked at the data for the monoclonal antibodies. That means it's just a single type of antibody. And in our opinion, given the challenge in delivering that therapy, at this point, we think it requires further study. Before we would move forward with that, we have convalescent plasma trials underway. We have monoclonal antibody trials underway. We will continue to enroll patients into those trials, and when we have convincing data that those things work, then we will roll them out. So we're not going to do that yet. We are delivering remdesivir earlier in the course of disease. We've just the onset of a new oxygen requirement, and based on everything I know about antivirals, I think it's got a higher probability of having success the earlier it's delivered. So we're watching this very closely, but at this point I do not anticipate in the near future that we're going to be opening up an infusion center for the monoclonal antibody treatment. That's where we're at today. Again, things change quickly. It all starts with first following the rules. And as I said when I was at the governor's press conference, right now we have most people doing the right thing most of the time. And that's helped slow the spread, but it has not stopped the spread, and it is not enough to keep cases from going up. What we need is everyone doing the right thing every day, and that will get us back to a decline on those inpatient admissions. Now, from the time that the governor enacts greater restrictions to the time that such that it has an impact on inpatient cases, that's probably 4 to 5 weeks. So even if we did a rapid shutdown today, like we did in the spring, the shelter at home, it would not likely have an impact on hospitalizations for about 5 weeks. And so we're hopeful that these restrictions will slow the spread or get us into that less than 1 transmission rate. But we won't know for about 5 weeks. And again, with people going indoors, with people, the holidays coming up, we need to be ready for a continued increase in cases that, in my opinion, could hit 300 or 400 early in January. Next slide. So not only does the governor have new rules, but Justin has new rules that he wants to talk to you about to assure that we're doing everything we can to stop the spread of this horrible disease. Let me turn it over to Justin now.
Thanks, Eric. I appreciate that. So one of the big things we've been really watching closely is our visitor policies. We really go and believe that the visitors really are a conduit and part of the overall care team. So we've taken great lengths and put a lot of considerations into maintaining the ability for patients to have visitors. And some of our wave 2 planning and really watching what's going on across the state and then benchmarking against other organizations. We've put some restrictions in place. And that is, patients who are non-COVID or non-PUI are allowed 1 visitor per day. We've restricted the hours to be between the hours of 10 and 8. The end-of-life patients who are non-COVID or non-PUI or who are under surveillance, meaning that they may have no symptoms but just admitted to the hospital and their testing is not back yet, are allowed 2 visitors. And then no visitation for patients who are COVID positive or PUI. We are working for those COVID positive and the PUI patients to really put some options in place for them to use FaceTime, Skype, and other modalities and technology solutions so that they can still, connect with their loved ones. We've done this across the system and have stayed coordinated between the community hospitals and the medical center, to make sure that we're aligned. At times, our visitor policies may be slightly different based on what's going on in that specific community. So, for instance, up at Health Alliance, shortly after the Fitchburg church outbreak, they constricted their visitation policy a bit sooner than we did in Worcester and a bit sooner than Marlborough did. But Marlborough quickly followed suit, and we did as well in Worcester. So, like I said, we continue to watch this. It's an evolution. I think to Eric's point, as we look at transmission rates and we look at symptomatic positivity rates, a lot of those decisions will guide how we manage the visitation and the number of people that are in the physical building. Another way to just increase safety is some new infection control guidance, really around the safe exchange of items. So this is very much focused on ambulatory and some of the inpatient areas, and really around, handing of pens and pencils, the transitness of passing papers back and forth, iPads and signage pads to really try to limit that. So really leveraging the technology we have through MyChart, doing as much as we can online ahead of appointments and ahead of schedule, and then making sure that it's kind of a one-way passive document so that we're passing the information to the patient but not passing it to them and taking it back. And then for items that do need to be shared, having a clean and dirty container so that you can wipe down those containers and wipe down the items once they've been used and disinfect them appropriately. I've seen this actually in a number of stores, and actually, ironically, one I was in recently, you had to sign with a stylist, and that's exactly what they did. They had a clean stylist and then dirty ones, and it's a great way to just kind of keep it separated and make sure that we're following all of our infection control guidance. And I think for the eye protection, I'm going to ask Andy to kind of comment on this.
Great, thank you, Justin. So as folks know, we have a new policy regarding eye protection that came out last week, where eye protection must be worn in all clinical areas and is strongly encouraged in non-clinical areas. Having eye protection, make sure you don't cut your eyes, but also would help just generally decrease the risk. Care area is defined as anywhere there are patients. So if you're in a hallway, in a hospital or clinic, in a cafeteria, in a lobby, in a waiting area, and you can see all the different kinds of eye protection types here on the bottom of this page. So please wear eye protection, especially in clinical areas. Next slide, please. And then speaking a little more broadly about PPE and social distancing, vigilance, Dixon covered some of this from the state level, but here in our system, we want to remind all caregivers to wear a mask at all times while in the hospital, unless they're in a private office or a room by yourself, and you can take the mask off. When you're in break rooms, you should wear a mask unless you're eating, and even when you're eating, try and remain 6 feet away from others when you do take your mask off to eat, which you have to do to eat, but keep the mask on as much as you can during that time. Of course, adhering to the maximum occupancy limits in the break areas, and they're posted all around our system, the maximum number of folks that can be in a room to stay appropriately distanced. Again, wearing eye protection in clinical areas, and then of course placing masks on patients who can tolerate wearing a mask. On the right side here, just to remind ourselves, if you see others not adhering to protocols, please remind them of our guidelines as part of the citizenship. We all take care of each other, take care of our patients and their families. And if you're given a reminder, please follow our standards of respect and thank your colleague for putting safety first and reminding you. Thank you.
I think we're going to have a contest as part of the Innovators of the Year to figure out the best way to keep your goggles from fogging up when you're wearing a mask. The scuba divers say that you use a little dish soap on it and clean the inside with dish soap, and that works best. I've seen some other things out there as well. If anybody has any great ideas about that, please send them to me. So as if COVID wasn't enough, we have other major challenges going on throughout healthcare, not unique to UMass Memorial. One of the biggest ones being cybersecurity. And Robin Zidano and Bruce Foreman and the team in IT are doing everything they can to prevent any malware or ransomware getting into our system such that it could shut our IT system down. But their work isn't enough. There's always going to be a link or an attachment or something that's going to come through that if one of the 14,000 of us that have access to the email system clicks on, we will put in allow ransomware to get into our system. And this can shut down your whole electronic health record if it happens. If we see that there's a significant threat out there such that we have to take additional action, we're just going to block all external emails from coming into the system. That would be very hard for a lot of us to deal with a lot of external constituents, but we may get to the point that we have to do that. Please, please do your part to make sure that you don't click on any links or open any files that are not absolutely from a secure source. Other challenges, unless you've been sleeping under a rock, you know that there is significant racial tension in the United States. And part of that tension is coming from the inequity that is occurring in the number of people of color that are getting COVID versus the Caucasian population. There's lots of reasons for this right now, but that is a significant source and it's in the news every day. We here at UMass Memorial believe that everyone should get the same great level of care regardless of the color of their skin, their gender identity, or their sexual orientation. But we know that that's not always the case. So we've taken specific action to try to address these challenges within our own organization. I won't read the slide to you, but I think one of the most important things is to thank Doug Brown and the search committee who's just signed a new Chief Diversity and Inclusion Officer. Can't give you the name yet, but we'll be announcing that very soon. I think one of the other things that I'm really excited about, I asked for ideas, as I always do, about how we can reduce the inequities that exist and the failure to be a completely inclusive organization that exists here. And you sent me pages and pages of ideas. And one of the things I've learned over the years about getting ideas is you have to have the people that came up with them implement them. So we are starting a grants program that you can apply for a grant. It's part of the innovation fund, but we've put a separate pool of money to the side for that. And if you have any ideas about how you can make UMass Memorial a more equitable organization or a more inclusive organization, you can apply for a grant to try something new and innovative. And I can't wait to see what the grants look like. The first grant applied for was for us to do a Facebook Live event on this topic and to invite a great group of people. I'm getting all sorts of ideas coming up against the anti-fog something onto the screen. To do a Facebook Live event with Congressman Jim McGovern, Matty Castile, Dr. Solomon, to talk specifically about this and address this issue. We had great turnout, and I thought it was a wonderful way for us to keep the conversation going. We're not going to let silence rear its ugly head. We're going to keep this conversation going, and we're going to take specific action. One of those actions is to move one of our True North metrics to an equity metric. And to tell you, we looked at dozens of metrics that we could have chosen that show that if you're Black or if you're Latinx versus Caucasian, your care is not the same. But one of the ones that was most disturbing to us is the percentage of Black and Hispanic children getting well child visits compared to Caucasian children that are cared for by UMass Memorial. They're all in our database. And there is a significant gap that exists there, and we are going to try to close that gap this year. We are going to post in our boardroom our performance, which is embarrassing, on that metric. And Eric Elfer and the team that are working on the quality, and I know our friends in OCI will be doing this as well, are going to help us close that gap this year. We have additional equity goals, leadership goals within the system, and this is on everyone's goal sheet for this year, and truly will impact at-risk compensation for about the 600 managers that are part of that program. So 2021 is the year of action on this for us. And I can't wait to sit here at the end of the year and talk about the progress that we've made. PPE was the big challenge at the first surge. I have to say that the big challenge this time is not likely to be PPE, thanks to Henry Lopez and his team that have done amazing work to stockpile everything we need. I'm probably most concerned about provider burnout and the ability of our caregivers to really get through this second surge as we have the vaccine come in, hopefully, and start to, again, play offense and prevent cases from occurring with the vaccine. We have a lot of work going on in this space. You probably all just received a mailing about the Employee Assistance Program. We're working with Optum to administer that program such that you don't have to apply within, and if you're potentially embarrassed about reaching out for assistance, we outsource that so that it would be somebody away from UMass Memorial that would help and assure the anonymity related to that. So we've got some great resources there. We also felt it's so important that we do something to show our profound appreciation to our caregivers for the great work that they did, not just with managing the first surge, but in the recovery. Money is tight, but we came up with a pool of dollars to do an appreciation bonus for all of our caregivers, with the exception of chairs and executives, and then a commemorative gift. And we are going to make sure that we find a way to get our residents and some of the other key folks that don't work for UMass Memorial that appreciation bonus and gift as well. So this year on the fleece, you're going to have the words relentless, and it epitomizes who you are right now. Because what I have seen in the past year, I haven't seen in the other 29 years that I've been associated with UMass Memorial. You just keep on fighting, taking great care of our patients and one another, and can't thank you enough for that. We will have a winter ball this year. It will not be in person. You know, this is our big annual charity event. This is the first global UMass Memorial Healthcare Winter Ball. Our new Chief Philanthropy Officer, Kathleen Driscoll, is leading this effort with the help of many. This year, the proceeds will support the UMass Memorial Healthcare Ease Fund. So that's our employee assistance fund. So the dollars that we raise, we will give back to our employees with the greatest need that are suffering right now for financial hardships. You know, despite dealing with all of those challenges, we can't stop thinking about the future and what our strategy is and how we are going to emerge from this stronger and a better healthcare system. And so we did, as our standard, put together our set of 2021 strategic priorities. We are going through a strategic planning effort, a virtual strategic planning effort at the same time. I just wanted to call out a few highlights to you about this. Number one, we're going to use our lean management system to continue to improve the quality of the care that we deliver to our patients. Got a great new Chief Transformation Officer, Penny Aielli, working specifically with me on the management system. This is the year that our idea system and our management system gets fully deployed. Just about 8 years ago, I was asked during one of these town halls that we were doing in a movie theater then, if lean training was mandatory, going to be mandatory for everyone. I think there was this sense that this was the flavor of the week, and I said no. This year I'm saying yes. Everyone here needs to be trained in lean. Everyone needs to be participating in our idea system, and because that is a key part of really our culture of innovation and engaging every one of our people every day. The other thing this year is going to be a continued focus on our standards of respect, right? In addition to the work that we're doing on diversity and inclusion. Truly, everyone every day needs to be about everyone. Right? The first two performance evaluation items for everyone in the management this year is going to be how well you adhere to the lean management system and how well you adhere to the standards of respect. You'll have some other things in there about quality metrics in your area, but those are the first two. And I know we're under a lot of stress right now, and I know it seems like this is just another thing. This is the thing that got us through this, how we took care of one another during the surge, and the fact that we have been developing our problem solvers for the past 8 years. And I know that it's because of these two programs, we're going to get through the second surge as well. And whatever comes next, because there will be something coming next. The other thing I will want to just call out, there'll be some growth initiatives in here, but we are going to do work in our communities like never before. Through our anchor mission, our community health link programs, our community benefits program, we're going to go into underserved neighborhoods, and UMass Memorial is going to transform those neighborhoods by partnering with everyone we can. Many thanks to Monica Lowell, Cheryl Apriori, Doug Brown, Cameron Lundy for helping on that item number 5. We're not going to wait for people to get sick and come to our hospitals anymore. We'll be here for them. We're going to get out and we're going to improve the health of our communities by addressing the social determinants of health. Next slide, please. Innovation, innovation, innovation. We need to embrace innovation at all levels of this organization, whether it's what Jonathan Gerber's doing with convalescent plasma, Dr. Finberg's doing with the vaccine research, or little simple things that people are doing to just improve their daily work. Constantly, we need to be innovating. And we need to do so in a way that shows respect for people or I'd say if you don't show respect for people, nobody's gonna come up with ideas about how they can do the work better. That's our culture. And in 2021, we're gonna put it into hyperdrive, and we're gonna put it virtual for you. Penny Ionelli has been working the past couple of months with Matt Wozanowski and Cleona to put together a virtual idea system, which will allow us to spread our idea systems beyond the typical daily huddle to every shift wherever somebody is in the organization. You could do your huddles from home if necessary moving forward. And since a larger portion of our workforce is going to be working from home, this is the direction we need to go in. We're going to be rolling out this platform in January, and I can't wait to see what the Innovators of the Year, who wins that next year, because it will be definitely be somebody that's leveraged this platform in a way we haven't imagined. So my charge to you today is the same as in past town halls. Number one, be safe. Make sure you're keeping your patients safe. Make sure you're keeping yourself safe. You got to get patients in that need to be seen. I know it's harder now, but you cannot let people end up here with advanced stage disease because we couldn't get them in when they had early stage disease. Take pride in this organization because we really have done a fantastic job, and everyone in the state knows it. There's a reason we're the only ones that have been asked to stand up the field hospital. There's a reason the governor and the lieutenant governor came to us first, because they have more faith in us to be able to do that. Innovate, innovate, innovate. Always be looking for new, better ways to do our work, and then, take great care of our patients, but also please take great care of one another. We're all really, really tired, and we're all, walking on eggshells now. You have no idea what that person that you're going to interact with in the elevator or just passing the hall is going through. So please look up, put a smile on your face, even though you're going to be wearing a mask in classes, and say good morning or good afternoon. Look for people that are having trouble. And with that, I'm going to turn it over to my panelists to do some questions and answers. Who's got the first one?
I could do a couple that came in, and we've been answering the questions along the way on the question and answers, so many of the answers are already out there. So one question was about, will the vaccine for coronavirus be mandatory? And the answer is no, we don't expect it to be mandatory, especially anytime soon, in this emergency use authorization that will hopefully come out in the next month or two. We don't expect that to be mandatory anytime soon. Other questions about the vaccine were, what about non-clinical employees about getting the vaccine? And again, we're waiting for the guidance from the regulatory agencies, who they recommend, and then our own internal task force that Dr. Dixon had mentioned are reviewing that. It'll be the frontline workers that are being exposed to patients. All caregivers of any type that will be working with COVID patients will be the first group, and then depending on the vaccine availability, we will go to high-risk patients and other caregivers as well. And then a couple of questions about long-term effects of the vaccine. So far, both the Pfizer and the Moderna vaccines look to be safe in the several months of study that they had. They're ongoing long-term reviews, but so far, so good. This is maybe one more than maybe I know there were some human resources ones, Joanne, you might want to comment on. So for plasma, people that want to donate plasma that have been COVID positive, we put in there the UMass COVID plasma at umassmed.edu is the website. And then finally, a lot of folks asking about how to volunteer at the Stop the Spread testing area, and some folks that are interested in applying to work at the CDU, and we gave the contact information in the question and answers.
Yeah, thanks, Andy. Hi, everybody. This is Joanne Doherty in HR. A question came through about, would it be possible to maybe once a month or every so often offer the white belt training, on the shift, as opposed to, needing to stay to take the class, and extend their time here. So it's a good suggestion. I'll pass it along to OPD to see if that's a possibility.
You can do it virtually now.
They have, right.
But you have to do it virtually now. No more Mr. Potato Head. Turns out he's a vector for.
It's too bad, yeah. And really, there are these questions about kind of the, questions about is the vaccine gonna be mandatory from people and, volunteering, lots of questions about wanting to volunteer. So, for the testing site in particular, we gave them sort of direction on, there's no other platforms right now. We're taking volunteers to volunteer at other testing sites. But for the DCU, we're working on, looking, to hire for the DCU initially, using external resources, and then we're gonna take a look at, if we do have needs, for our own employees, we'll be following up later. But if there's a specific question from somebody who works in EMT, speak to your supervisor, and also, contact me, but right now we're not, looking to have people, our own employees work at the DCU right now.
Other questions? Anything we missed from the group? All right then, Thanksgiving. My favorite holiday by far. And, I think there's nothing better than getting together with your family and the people that you love, sharing a meal, probably overeating, and then sitting down on the couch and watching a little football. No presents, none of that. Just getting together with the people you love and having a good meal. Unfortunately, this year, the recommendation is that you celebrate Thanksgiving with your household and not across households. That's going to be really challenging for a lot of us. I must say I'm not real popular in my family for saying that we're going to adhere to that recommendation. Thanksgiving ultimately is about thinking about what you're grateful for. And, certainly in addition for me, and I hope for you, having a wonderful family that is all healthy right now, I am very, very grateful to be able to serve as your CEO and to be part of an organization where I know we're all coming into work and making a difference for our community, especially now. I've said this multiple times, you were always essential. And now people recognize that at a higher level, but you've been saving lives every day for a long time. And so as we close our session today, I just want to say thank you to all of you for everything you do. Take great care of our patients and one another, and have a wonderful Thanksgiving without spreading the disease, and we'll catch up soon. Bye for now.